Hi, this is Dr. Gary Sykes, and in this vlog I'd like to talk about engagement of the baby's head with reference to a patient that recently had a baby with me where the baby's head remained unengaged in second stage labour, and she ended up with a normal vaginal delivery. So Carrie-Anne came to me for her third ongoing pregnancy. The first two babies had been delivered by other doctors, so this is the first time I met her. Now, the pregnancy progressed and she came in at 38 weeks with ruptured membranes. Because she failed to establish in labour, we commenced a syntocinon infusion to start off the contractions. There was a little bit of a slow start and then she progressed very well. At about 9 centimetres, the midwife contacted me to say she was worried about the baby's condition. There was an abnormal fetal heart rate pattern. Now, I was able to, in my rooms, check this out myself. So I could go to the heart tracing, the heart monitor, and actually see what the midwife was looking at. I agreed that the baby's heart rate pattern was abnormal. I advised the midwife that she should stop the syntocinon infusion and that I would attend immediately. So I left the patient that I was seeing in my rooms and I went immediately to the hospital. When I arrived there, the abnormal heart rate pattern had settled, so I was greatly relieved, as was the patient. I then proceeded, with her permission, to do an internal examination. She was now fully dilated, so the cervix was fully dilated, but the head was not engaged. The head was about 2 centimetres above the ischial spines. That's the level, as I mentioned in the previous vlog, that we use to check if the baby's head's engaged. So the baby was not engaged, although fully dilated. The baby was in an occipital posterior position, so I suspect that was the reason. As the baby's heart rate pattern was now normal, I advised the midwife to restart the syntocinon infusion to increase the strength of the contractions. In the meantime, I went off to the nurse's station to have a cup of tea and just wait. Time passed. I came back into the room and did another examination, but again the baby's head was not engaged. Because the baby's head was not engaged, she had actually no desire to bear down. I encouraged her to do so briefly, but it didn't work. So we left her. Now, the next thing that happened is we encouraged her to get out of bed, to stand up. So she stood up, feet on the floor, resting against the side of the bed. So with the syntocinon infusion happening and the aid of gravity, then the baby's head now descended. So the baby descended, the baby became engaged. She then developed the desire to bear down, and so she started to bear down very successfully. So with her standing upright, legs apart, and me standing facing her back, she delivered her baby. The baby's head carefully came out. I protected the perineum, so there was a gentle delivery of the baby's head into my hands, which were below her. So I delivered the head and then delivered the rest of the baby. I then passed the baby through under her legs, through between her legs to the midwife, who was standing on the other side. So the midwife took the baby, put the baby on the bed. Fortunately, there was quite a long cord. With the baby on the bed, we were able to clamp and cut the cord. Then Carrie-Anne got back up onto the bed and was cuddling her baby while I delivered her placenta. She had only a first-degree tear, which was good. So after local anaesthetic, I was able to suture that without any issue at all. So Carrie-Anne did extremely well, and illustrates the point that the baby's head does not need to be engaged until even in second stage labour, and everything can work out well. Often a woman gets so anxious that my baby's head is not engaged. She thinks, often a woman thinks that, and husband think the baby's head has to engage to go into labour. That's not true. That's not true at all, because many a scenario the head does not engage till a woman's in labour. Admittedly, Carrie-Anne was an extreme of that, but certainly that's what can happen even in second stage labour, and all can work out very, very well. Bye for now.